Okay, for number 51, how many Caucasians in a population of 100,000 will have the following combination of phenotypes? So, what are given? We have the system, we have the phenotype, and then the frequency. If given na po yung frequency, what we have to do is you have to multiply the given frequency. As here, we have 0.45%. So 45% is 0.45 times 0.48 times 0.37 times 0.18. And you will get, multiply this, and then multiply this first, and then you have to multiply it after with the 100,000 population. So the answer is 1,438.56, or simply letter D. So the observed phenotypes in a particular population are the following. So we have a phenotype for JKA positive B negative of 122, JKA positive B positive 194, JKA negative B positive 84. So what is the gene frequency of the JKA in this population? So in this question, we need to use the Hardy-Weinberg formula, which is P plus Q is equals to 1, in which P indicates the gene frequency of the dominant allele, and Q is the frequency of the recessive allele. In this case, the dominant or the homozygous trait or population in this observation is the JKA positive B negative. So with the value of P squared, we need to square root this. We need to get the square root value of P squared for us to get the value of P. So, in this population, out of 400 people, the total number of persons in this population, which is 400, there were 122. So, 122 divided by 400, there are about 30% persons that are considered as homozygous for the trait JKA positive B negative. So, what is the square root of 30%? So, square root of 0.30 is equals to 0.55. So, the answer for number 52 is letter C, 0.55. If ang tanong naman po is what is the frequency of the recessive allele, it's just the same. Kaso nga lang, ang gagamitin natin, instead of the 122, we need to use the recessive allele, which is the A negative B positive, which is 84. So 84 divided by 400, that is 0.21. So we get the square root of 21%, which is 0.21. That is equivalent to 0.46 frequency. So the frequency of the recessive allele would be 0.46, while this value 0.55 is the frequency of the dominant allele. Number 53, in a random population, 16% of the people are Rh negative. What percentage of Rh positive population is heterozygous? So we can compute for this value using the Hardy-Weinberg equation, which is P plus Q is equals to 1, and then the Hardy-Weinberg equilibrium P squared plus 2PQ plus Q squared is equals to 1. So what is given is 16%. So let us use this as the value of the frequency of the non-dominant allele. So 16% is equals to q squared. So to get the value of q, we have to get the square root of 16%, which is 0.4. 0.4. So using this value, we should use this in getting the value of our P. So P plus Q is equals to 1, which is equivalent to P plus 0.4 is equals to 1, giving us the value of P to 0.6. Using this value, we can now compute for 2PQ, which represents the frequency of the heterozygous population. So here we use 2 multiplied by 0.6 multiplied by 0.4. What we will get is 0.48, or equivalent to 48%. So the value of 48% represents the Rh positive population heterozygous for R. Number 53, letter B. Number 54, patient's AHG test was negative. When checked cells are added, no agglutination was observed. What could be the cause of negative reaction? The choices are letter A, insufficient saline from the cell washer. B, serum was not added. C, there is insufficient incubation period. Or letter D, this is a valid report AHG test. So, in this case, the AHG test was negative and there is no agglutination after the addition of check cells. So what are the possible reasons why we encounter this in the laboratory? So the following are the false negative reaction detected by the negative Combs control cells. Number 1, there could be inadequate cell washing. Number 2, there could be a delay in adding the antiglobulin reagent after the washing step. Number 3, there are presence of small fibrin clots. Number 4, antiglobulin reagents could possibly not added, or the HG reagent is inactivated. And lastly, okay, there are possibility that free antibodies remain after the addition of the AHG reagent. So number 54, the answer is letter A. There is insufficient saline from the cell washer, therefore there are left free antibody in the free antibody causing negative reaction to the Combs control cells. Letter A is the answer. Number 55, which antibodies to a component of complement are contained in the rabbit polyspecific anti-human globulin reagent for the detection of the in vivo sensitization? Choices are anti-IgG and anti-C3A, letter B, anti-IgG and anti-C3D, letter C, anti-IgG and anti-IgM, and letter D, all of this option. So for number 55, the answer is letter B, anti-IgG and anti-C3D. So for 55, letter B, anti-IgG and anti-C3D. So in that, or the direct antiglobulin test, the rabbit polyspecific anti-sera contains both the anti-human IgG component and an antibody against C3D component of complement. Number 56, given a situation where screening test or screening cells, major cross-match, autocontrol, and DAT are all positive, what procedure should be performed next? Choices are letter A, adsorption using rabbit stroma, letter B, antigen typing of patient cells, C. Elution followed by a cell panel on the eluate, or letter D. Select cell panel. So, a positive dot using anti-IgG indicates that antibodies are coating the patient cell. So, what we can do is to get an eluate, this would be helpful to remove any unbound antibodies followed by a cell panel in order to identify it. So, number 56, the answer is letter C. 56, letter C. So for number 57, which of the following drugs has been shown to cause drug-induced red blood cell sensitization? So the choices are letter A, methyl-dopa, B, cephalosporin, C, penicillin, or letter D, all of this. So the answer for number 57 is all of this. Methyl-dopa is known drug which induce autoantibody formation. Cephalosporin, this is known drug which causes membrane modification. And penicillin, this drug adsorb on the red blood cells, acting as a hapten. And we have quinidine and phenacetin, which causes or produce immune complexes. So these drugs can be attributed to drug-induced immune hemolysis, and these are the mechanism. Number one, it can be adsorbed to the patient red blood cell. Once it is adsorbed in the patient red blood cells, the patient will produce antibody against it. Number two, second mechanism, the drug red blood cell membrane protein immunogenic complex. So the drug binds loosely to the RBC membrane protein, forming RBC protein and drug immunogenic complex, or epitope. So here, the patient will produce antibody that will bind to this complex. And number three, RBC autoantibody induction. So a drug may induce the patient to produce immunoglobulin G warm reactive autoantibodies against the red blood cell self-antigens. So this is from Rodak. So number 58, if a group A patient was cross-matched with an O donor, the result would be choices: major side incompatible, letter B, minor side incompatible, letter C, major and minor sides incompatible, or letter D, major and minor sides compatible. So this is cross-matching. This is also known as your compatibility testing. So this is an important test before we do blood transfusion. So the primary purpose of cross-matching is we want to detect ABO incompatibilities between donor and recipient prior blood transfusion. And this is carried out to prevent transfusion reactions by detecting antibodies in the recipient's serum. So, our cross-matching can be major or minor cross-match. Major cross-match involves the testing of the patient's serum and donor's red cell. We indicate this as your PSDR. For minor cross-match, this is indicated as your PRDS, which tests the patient's red cells from the donor serum against the donor serum. So using the given group A patient and type O donor, so we can identify what are the antigens present in the patient's red cell or donor's red cell, or what are the antibodies present on both either sera. So for major cross-match, the patient's serum, since this is group A, so they contain anti-B in their serum. Donor red cell, if it is type O, so it has no A or B antigen on its red cell membrane. For minor cross-match, we have patient red cells, which contain A antigen on its membrane, and then the donor serum has anti-A and anti-B. So looking into the major cross-match, there would be um, no contradicting factor, since anti-B will not react with the donor's red cell owing to the absence of both A and B antigen. So major cross-match is said to be compatible. Minor cross-match on the other hand, since the red cells of the patient contains A antigen and the donor serum contains anti-A, so what will happen is there would be a reaction. So for number 58, the answer is letter B, minor side incompatible. Which of the following will be incompatible in major cross-match? So, as discussed kanina, we during major cross-matching, we test patient serum against donors' red cells. So, let's check per choices. Group A, positive recipient with Group A negative donor. Since they have the same ABO type and the donor is Rh negative, so the major cross match will not affect major cross match would be compatible for this pair. Letter B, Group A positive recipient with Group AB positive donor. So the patient serum contains anti-P. So what we don't want is receiving a blood unit with B antigen for major cross-match. So here, if the donor red cell types as group AB, meaning to say the red cells contains A antigen and B antigen on its cell membrane. So this anti-B will later on react with the B antigen present on the donor's red cells. So number 59, the answer is letter B. Group A, positive recipient receiving from Group O positive donor, since Group O individuals do not contain antigens A or B on its red cell membrane, so major cross-match, they are considered as compatible for major cross-match. So 59, letter B. Number 60, major cross-match is positive on immediate spin only, and the autocontrol is negative. Identify the problem. Choices are letter A, cold alloantibody, B, cold autoantibody, letter C, abnormal protein, or letter D, antibody mixture. So immediate spin is performed by adding red cells and patient serum or plasma to a test tube at room temperature, and then immediately subjected to spinning or centrifuging, then later on be examined visually for agglutination. The immediate spin is very helpful in detecting IgM antibody reacting at room temperature. Reacting at room temperature. So, immediate spin is only helpful in detecting this kind of antibody, but the clinically significant immunoglobulin G or IgG antibody is not reacting with the immediate spin because it reacts specifically at 37 degrees centigrade. So, for a positive immediate spin, we what do we what do we expect? Since it is immediate spin, so what we expect is antibody that is reacting at cold temperature. However, to differentiate allo-antibody from auto-antibody, we check the autocontrol. The autocontrol is negative, so therefore, the reacting antibody is of letter A, cold allo-antibodies. So remember, allo-antibodies versus autoantibodies. Allo-antibodies are immune antibodies that are produced following exposure to foreign blood cell antigens, while the autoantibody, these are produced in an autoimmune process directing against self blood cell antigens. 60. For number 60, the answer is letter A, cold alloantibody. 61. Can cross-matching be performed on October 14 using a patient sample drawn on October 12? Choices are A. Yes, a new sample would not be needed. B. Yes, but only if the previous sample has no alloantibodies. C. No, a new sample is needed because 2-day limit has expired. Or letter D. No, a new sample is needed for each testing. For number 61, the answer is letter A. Yes, a new sample would not be needed. Why? Because in compatibility testing may be performed on patient sample within 3 days of scheduled transfusion. So, within 3 days of the scheduled transfusion. This is contraindicated if the patient is pregnant or was transfused within 3 months. So, if patient is pregnant or have received or transfused with blood within 3 months, the sample must be less than 3 days old. Okay, so sample must be less than 3 days old. So this is the exception. So within 3 days of scheduled transfusion, possible po ito. So number 61, letter A. 62. How long must a recipient sample be kept in the blood bank following transfusion? So, number 62, the answer is 1 week or 7 days. 1 week or 7 days. So, the American Association of Blood Banks or AABB standards on 20th edition, they mandate the minimum storage retention of recipients' samples. So, the recipient samples or blood samples must be kept sealed or stoppered and kept at refrigerator temperature for at least 7 days after each transfusion. So number 62, the answer is number 62, the answer is 7 days, letter C. 63. Anti-K and anti-small c were found in a patient with colon cancer. How many units of red cells would need to be screened to find 2 compatible units for surgery? The antigen negative frequency of K and C are 0.91 and 0.20 respectively. So we want to get the number of units to be screened for us to get 2 compatible units before the surgery. So for us to get it, we need to compute for the number of units to be screened, which is computed as the number of units requested divided by the frequency of antigen negative individuals. In this question, given na po yung antigen negative frequency, which is for the K antigen, the antigen negative individuals is antigen negative individuals is 0.91. For the C antigen, we have 0.20. So, we substitute the formula. So, given, we need 2 compatible units. So, divided by the frequencies, which is 0.91, multiplied by 0.20. So the answer here is 10.989, which is equivalent to 11 units. So meaning to say, we need to screen 11 units of blood for us to get 2 units of compatible blood units. Number 63, the answer is 11 units. For 64, so parang katulad din yan kanina, pero ang given kasi dito is hindi antigen negative frequencies or percentages. So what we do is to minus lang from 100. So again, using the same formula, number of units to be screened is equal to the number of units requested divided by the frequencies of the antigen negative individuals. So, substitute this. Ilan ang kailangan? We need 2 units red blood cells. And the frequency of antigen negative individuals, it has to be computed as JKA positive. So, antigen negative individuals would be of 23%. K frequency or antigen K frequency is 10%. So getting the antigen negative frequency, it would be 90%. So using that value, we compute the number of units to be screened. So 0.23 multiplied by 0.90, and we are getting the value of 9.56 or equivalent to 10 units. So number 64, the answer is letter B. Answer is letter B, 10 units. Number 65, the patient has requested 2 units of red blood cells for patient DB who has 2 antibodies. We have anti-L and anti-Q. The frequency of antigen L is 45% and the frequency of antigen Q is 70% in the donor population. Approximately how many units will need to be antigen type for L and Q to fill the request? So, substitute with the given formula kanina. So, we need 2 units. Antigen negative individual, what is the frequency? For the L antigen, we have 45%. So, minus 100, that is 55%. For Q antigen, we have 70%. So, the frequency of antigen negative individual in percentage is 30%. So, using this value, we can now compute for the number of units to be screened. 0.55 multiplied by 0.3. So, 2 units divided by 0.55 times 0.3, the value is 12.1. So, the number of units, blood units to be screened, for us to get a compatible 2 units of blood, we need to screen 12 units. Number 65, the answer is letter B. We need 12 units. 66. A physician orders 2 units of leukocyte reduced red blood cells. So the patient is a 55-year-old male with anemia. He types as AB negative and his antibody screen is negative. There is only 1 unit of AB negative in inventory. What is the next blood type that should be given? So given that our patient is AB negative, giving Rh positive red blood cell to him will not actually cause a harm. However, it is not routinely done in the laboratory that we use such method. So letter A is not actually the best answer. In this case, the correct answer is A negative. Why A negative? Because A negative units would have residual anti-B of this packed red blood cell, and these are said to be less immunogenic than giving B or O red cells. So for number 66, the best answer is letter B, A negative unit. 67, the poorest ABO choice for an AB recipient is, we have number 67, Group O. Why Group O? Group O is considered as the universal donor due to the fact that they have or they lack both A and B antigens on red cell membrane. However, their plasma contains anti-A and anti-B, presenting a high risk of hemolysis once in contact with certain non-group O recipients. So, for number 67, the answer is Group O. Number 68. If a patient is Group O and the donor blood of the recipient's own type is not available, what other type or types can be used as packed erythrocyte? So, hindi daw available yung same type as with the patient's blood type, which is type O. So, what would be the possible blood types for blood donation? So, the choices are Group A, Group B, Group AB, or none of this, or none of the above. Rule of thumb, kapag ang patient natin is Group O, the donor type or donor blood type should always type as O. So, since ang patient natin is Group O, kailangan ang ating donor should always and singly type O lang. So, for number 68, letter D is the choice, the option. For AB, syempre first option would be type AB followed by type A and B and O. For type B, of course, first option would be type B, next option is type O, and type A recipient should receive from type A donor, and if hindi available si type A donor, we can use O. So, 68, letter D is the answer. Number 69. A patient who is Group AB, Rh negative, needs 2 units of fresh frozen plasma. So, which of the following units of plasma would be most acceptable for transfusion? So, remember, ang ating patient contains antigens A and B. So, never tayong kukuha ng blood, especially the fresh frozen plasma from those blood group producing antibodies against the antigens A and B. So, for this, in this case, number 69, what is the best possible answer? So, the best possible answer we get from Group AB, Rh positive. Bakit hindi pwede ang Group O? Ba't hindi pwede ang Group O? Remember, Group O has anti-A and anti-B. So, this would cause transfusion reaction, immediate transfusion reaction once transfused to this patient. Group A, on the other hand, if group type if group A would be the donor for fresh frozen plasma, it would introduce anti-B to the patient. So, hindi pa rin pwede. Ganon din si group B. Meron siyang anti-A. In this case, group AB contains no antibodies against A or B. Therefore, we can use this. Number 70, FFP can be transfused without regard for letter A, ABO type, B, RH type, C, antibody in product, or letter D, all of this option. So, for fresh frozen plasma, it can be transfused without the regard for the RH type since RH or FFP is not actually a cellular product. Number 71. Although ABO compatibility is preferred, ABO incompatible products may be administered when transfusing A. Single donor plasma, B. Cryoprecipitate antihemophilic factor, letter C. Fresh frozen plasma, or letter D. Granulocyte. So, the answer here is letter B. Cryoprecipitated AHF. So, cryoprecipitated hemophilic factor, it is a concentrated source of plasma proteins indicated for the treatment of hemophilia A, von Willebrand disease, congenital or acquired fibrinogen deficiency, factor 13 deficiency, and obstetric complication. This is not used to treat patient with deficiencies other than factor 8, fibrinogen, von Willebrand factor, or factor 13. So, what are the contraindication and precaution when using cryoprecipitated AHF? So, it is preferred to use ABO compatible cryo. Whenever possible, we use this since anti-A and anti-B alloagglutinins are still present. In rare cases, the infusion of ABO incompatible product may also be administered using this cryoprecipitated AHF. So in rare cases, there are infusion of large amount of ABO incompatible cryoprecipitate causing hemolytic reaction. So in this case, pwede po tayo magbigay ng ABO incompatible blood product for cryoprecipitate AHF. Letter B. Number 72. 4 units of packed red blood cells were brought to the nurse station at 10:20 a.m. 2 units were transfused immediately and 1 unit was transfused at 10:40 a.m. The remaining unit was returned to the blood bank at 11 o'clock a.m. The units were not refrigerated after leaving the blood bank. So, what would be the problem with this unit? Letter A, the only problem is with the returned unit. The 30-minute limit has expired and the unit cannot be used. B, the unit should not have been transfused at 10:40 a.m. because the time limit had expired. This unit and the remaining unit should have been returned to the blood bank. Letter C, the returned unit may be held for this patient for 48 hours but cannot be used for another patient. Or letter D, no problems. All actions were performed within the allowable time limits. So the best answer or the only answer for number 72 is letter A. So as much as possible, for blood transfusion, we want to deliver it to the ward and we want to transfuse it immediately to the patient. If more than 30 minutes has elapsed and a unit of blood is not transfused or cannot be transfused, the blood should be returned to the blood bank. In this case, the 30-minute limit has expired, therefore the returned blood should be discarded. So letter A is the correct answer. Number 73, which component has the longest expiration date? A. cryoprecipitate, B. FFP, C. Frozen red blood cells, or letter D. Platelet concentrate. So it is very important that we are familiar with the shelf life and storage temperature requirements on each blood components. So here we have cryoprecipitate, which requires a storage temperature of less than 18 degrees centigrade or less for it to be able to be stored within 12 months. The same with fresh frozen plasma, which can be stored in 12 months. We have your platelet concentrate, which has the shortest expiration date among the given choices. With 5 days from collection, this platelet concentrate should be stored within 20 to 24 degrees centigrade temperature. So the answer for number 73 is letter C, frozen red blood cells. Why? Because this blood component is stored in high glycerol at negative 65 degrees centigrade or less, and this can be frozen or stored within 10-year period. So the answer is letter C, frozen red blood cells. Number 74. In preparing platelets from a unit of whole blood, the correct order of centrifugation is letter A, hard spin followed by a hard spin, B, light spin followed by a light spin, C, light spin followed by a hard spin, or letter D, hard spin followed by a light spin. In preparing a platelet concentrate, we need a freshly collected whole blood. This freshly collected whole blood will be subjected to series of centrifugation. Firstly, the first centrifugation will be a light spin. This light spin, this is the first centrifugation which requires a low RPM and a shorter time span of centrifugation. So after this first centrifugation, our blood unit will be divided into two, red blood cells and a platelet-rich plasma. Okay, again, red blood cells and platelet-rich plasma. This platelet-rich plasma will be subjected to the second centrifugation, which is a heavy or a hard spin centrifugation. This centrifugation requires high RPM and a longer time of centrifugation. This will result to the separation of our platelet concentrate and residual plasma. Okay, take note that the plasma, all but about 50 to 70 ml of the plasma is being removed from the platelets. What is obtained, or yung naiwan po dun sa platelet concentrate natin that is needed, to maintain the pH of our platelet concentrate at 6.2 during storage. And remember, the storage for platelet concentrate requires 24 degrees centigrade, and that will ensure storage for about 5 days, maximum of 5 days. So again, number 74, the correct answer is light spin followed by a hard spin, letter C.